This is just a sample of the audiobook. To get the complete audiobook, access the link posted in the first comment.
Of all the bones in your body, your hip might just be the worst one to break. Fracturing this vital joint can necessitate replacement surgery, followed by months of slow and often excruciating recovery. For seniors especially, it can disrupt important routines, lead to isolation from social networks, and ultimately tip the balance between good and poor health, beginning a downward spiral toward death. Still, we can only be grateful, for without surgery, people would remain immobilized and racked with pain. The procedure and tools have improved since hip replacement surgery was first performed in the 1940s, but in essence, the method is the same. The patient is put under anesthesia, and the surgeon cuts into the skin and removes old bone, implants an artificial joint made of metal or ceramic, sews up the patient, and prescribes antibiotics and pain medication. Many patients require opioids for severe pain, which come with the risk of addiction. Hip replacement surgery costs around $40,000, not counting any extended nursing or rehabilitation, which is often needed, and around 400,000 such procedures are performed in America each year, double the rate from 15 years ago. For the sake of argument, let's ballpark the overall cost of hip replacement in America at $16 billion in 2019, and that cost is likely to climb as our population grows and ages. Hospital costs consistently climb faster than inflation and the growth of the broader economy, averaging 4 to 5% per year over the last decade. Not only will the number of hip replacements double again in the next couple of decades, but the costs will likely too. Today's $16 billion in hip replacement spending could become $50 billion in the next several decades. As things stand, hip replacement surgery and the associated inconvenience, pain, and growing costs are our future, our children's future, and our grandchildren's future. And yet scientists know a lot about how bones work, how they become weaker, and how they can be strengthened. For decades, scientists have been testing molecules to determine how to reverse bone loss to prevent fractures. Because of the high cost of making new drugs, far more than an academic laboratory can afford, researchers and investors have created and funded companies to develop some of these molecules into medicines that prevent bone damage, with some success, particularly for patients with osteoporosis and rheumatoid arthritis. If not for these breakthroughs, the rate of hip replacement surgery would be even higher than it is. Now, imagine that later this year, a company comes out with a drug that strengthens bones so effectively that a person's risk of fracturing their hip is cut in half. This drug would spare 200,000 Americans the agony and impairment of hip replacement surgery and save society $8 billion. After a couple of decades, with the cost of surgery over $60,000 and twice as many people at risk of fracture, society would be saving closer to $25 billion per year. Tens of millions of people, our grandchildren and their children, would live longer, fuller lives, thanks to this miracle drug. What's that worth to America? Such a drug would be one of the highest-selling medicines ever, pulling in many billions in U.S. sales and much more on a global basis until its patent expired. A jackpot for the company and a boon for humankind. As inexpensive generic versions of that drug continued to keep the rate of hip surgeries down for the rest of time, the savings to society would likely reach trillions of dollars. Yet, down the road, no one would talk about the cost of that common, affordable bone-building drug. It would be a gift from a long-forgotten era, paid for by a long-forgotten generation, like all of our generic drugs today.